Memorial Healthcare Foundation has worked with us on several projects, the first of which was a program called Chattis. Parents in general don't like to fill out paperwork. People in general don't like to fill out paperwork. So several years ago, we had tried to find a more advanced technological solution so parents could possibly fill those out ahead of time and not having to chase their children around while they're trying to fill out the paperwork within our office. One of the solutions that we did find was a program called Chattis. It is a web-based service where prior to our visit, the patient or the patient's family is able to log on and do the pre-assigned developmental or behavioral questionnaires. So by the time they come in, all those things are already completed ahead of time. The parents don't have to worry about that once they get to the office. Another one of the programs that we work with at the foundation is a program called Go Check Kids, which screens for visual impairments in children. It's actually pretty cool. The company sends you the device, which is typically an iPhone, and you take a photo of a child in a darkened room. The software then, through their web-based service, can screen for differences in vision between the left eye and the right eye, both if it's nearsighted or farsighted, and can screen for early warning signs of amblyopia or lazy eye. Amblyopia is a pretty common disease in children, but if it's caught early enough, can be corrected without surgical intervention. Memorial Pediatric and Adolescent Medicine is working on several initiatives with the foundation. One of the programs that was in town when I first came to Owosso was Memorial Fit Kids. It was very popular within the community. It was discontinued in 2018. I'm working closely with the foundation in an attempt to bring a program that is either similar or a replacement for that. Some sort of derivation of Fit Kids, or possibly a more referral-based program called Fit Kids 360. It's a program that run out of the Health Net of West Michigan. It has dietary education, exercise education, and it involves both the parents and the children. One of the programs that has been in place through the foundation, even before I came to Owosso, was a program called Reach Out and Read. Early childhood literacy has always been a focus within the pediatric community. Statistically, a child who is read to as early as 9 months has better language skills as they get older. The program supplies age-appropriate books at all well visits from 6 months to 5 years. Every time they come in, they get a book. So by the time they reach 5 years of age, they have a little library at home, apart from what the parents can provide. One other grant project that we're currently working on with the foundation is to supply toothbrushes for patients within our community. Our office has participated with a state program called Babies 2, or a fluoride varnish program, where we apply fluoride varnish to a child once they get their first tooth until they establish a dental home, typically between 1 and 3 years of age, depending upon the dentist. So one of the things that we hope to provide through the foundation is just when they get that initial fluoride varnish, an infant toothbrush, and then once they get older, a dental kit where they'll get a child toothbrush, a 2-minute timer, and a little fluoride sample. All of these initiatives would be difficult, if not impossible, without the support of the Memorial Healthcare Foundation. They've been a fantastic partner since I came to town, and I'm excited to work with them going forward.